Welcome to today's episode of Learning with Leaders. I have a very special guest today, Dr. Anke Diehl. She has been nominated Woman of the Year in the health industry in 21 in Germany. And she will be talking, of course, about, her medical background and her role as a CTO in the university clinics of Essen. It was an extremely insightful conversation. I hope you enjoy it as much as I did. Bye-bye. Anke, I wish you an excellent morning and welcome you to today's episode of Learning with Leaders.
Thanks, Paco. Good morning.
Good morning. Of course, you are an extremely interesting character with a lot of things to share, which I hope, of course, that our audience today will enjoy as much as I've enjoyed in our pre-briefing calls. So just a few words regarding yourself. You are a doctor, a practitioner. You have been raised, from what I understood, and also part of your education has been in South Africa. So that's a very interesting aspect. And now you are working for the university hospital in Essen in Germany. And you are CTO, Chief Transformation Officer. Is there anything significant you would like to add to my short presentation?
No, that's fine. So I'm a medical doctor and I also hold a master's degree in management. And apart from being the Chief Transformation Officer, the CTO of the University Medicine, I'm also head of the Digital Transformation Unit as such. And as you said, as you pointed out, I don't hold a German actually Abitur, but I went to school to United World College, the one in Southern Africa. So I did an international baccalaureate diploma.
Mm-hmm. So, given your cultural background, so not just being German, and as you know, I'm half Spanish, half German. In which instance, in which respect does this influence you in your or exerting the responsibility of a chief transformation officer?
Well, if it comes to digitalization as such, it's not only the technical process of changing manual processes into digital processes, but it's very much the cultural transformation behind it. In medicine, we do have a very strong hierarchy, particularly in Europe, in Germany, it's always been dominated by the medical doctors as such. And I guess I'm allowed to say that because I'm a medical doctor myself. And whereas from my experience in the rest of the world, a lot of education and proceedings actually have been interdisciplinary, much more than they've been in Germany. We have realized, for digital transformation that must be something that it can't be, for medically dominated, but it's one of the key factors, that people come together from all different professions, from IT technology, and whether they went to university, got a university degree or not, but you have to come together. You have to sit down together and actually look at the processes, and everyone is then participating in that digital transformation. And that's one of the key success factors also for us at the University Medicine in Essen.
Mm-hmm. Because you didn't mention it, I mention it now. You got an award last year. You got the award Medical Woman of the Year 21 in Germany. What did change, if anything changed, since this award?
Well, the award, which is, I suppose, always the case, if you win something prestigious, then a lot of public attention gets turned towards you. And the good thing about it is that not only if digital medicine has like all the MINT subjects, you know, all the IT subjects, being a male-dominated subject. And it's very good, you know, to realize that a woman can also be successful in digital medicine. So that's one of the nice things about it, you know. And then also people have kind of looked closer at what's the difference, you know, why are we so successful at the University of Medicine in Essen? And I think that is predominantly due to the fact that we try to avoid these hierarchy processes and that we work together interdisciplinary and also very much with our nursing staff because they spend a lot of time with the patients. I mean, the overall game for us all today is to do personalized precision medicine. So as in not only to try the same approach for everyone, but actually look very closely at the individual data sets. Of course, all safeguarded by data protection. That's a must as well. And that in Germany is probably a bit more the case than everywhere in the world and also has its problems. But it's definitely important for the patient to know that we don't, you know, sell their data sets or anything like that, but we look at them and analyze them in order to have a personalized approach to it.
So you mentioned digital transformation. So do you feel that is still perceived as something special to talk with a woman about artificial intelligence when you talk with other experts in your field?
Yes, definitely. AI is a very male-dominated technical area, and I mean, if you look at information technology, it's still such that more than 90%, you know, of the students that go into it, at least in the overall IT, not so much in medical informatics. Medical informatics, there are more women, but overall, you know, it's a male-dominated area. And in fact, last year in March, we started a very large consortium focusing on AI in medicine, which was given a grant by the Ministry of Economics and Innovation and Digitalization from the County North Rhine-Westphalia. And I'm head of that consortium. We were given 14.5 million euros spread out amongst 7 companies. And it's also the first time that such a large consortium in AI and medicine is being led by a woman, you know. So that is, as a matter of fact, something that is unusual. And at the same time, I still have the feeling that whenever I ask, well, you know, have you differentiated according to gender, for instance, if you look at the study population or algorithms, you know, have you indicated, you know, whether things come from a man or a woman, you know, the data sets, then people very often kind of look at me and think, oh, she's a feminist. But it's got nothing to do with feminism. I mean, our population is about half, you know, split up into 2 sexes. And then plus we also have a diverse section. And for that section, unfortunately, we don't have any data sets at all, you know. So I apologize, especially to the young people that very much, well, point at that and say, it's not only a binary approach. Unfortunately, I'd be very happy if we were to have, you know, binary data sets, but we don't even have that. Very often in studies, also in the medical population, and also, unfortunately for AI algorithms, you know, we only have data sets, full stop, you know, but they don't differentiate between the sex and or gender.
I see. So there is still a long road to cover with regards to artificial intelligence and the research you are conducting. So when I look back into my professional career, each time, you know, people are talking about change and transformation, it's of course on the one hand the topic itself which needs to be changed, whatever topic it is, but there's also to overcome the psychological hurdles in people's heads. So I mean, medicine, there are a lot of very well educated people, so you might be inclined to think there you don't have so much, you know, issues to overcome, blockages in the heads. So how do you perceive that change itself is different or same as in other economical areas in our life?
Yeah. As I pointed out, you know, for medicine, we do have a very strict set of laws and regulations. And of course, I mean, if you compare internationally Germany to, let's say, the United States of America or the Asian countries, you know, in many aspects, it's a good thing, you know, that we're not as liberal, free, you know, to use data sets. On the other hand, you know, in Germany, that also leads to the fact that we are probably a bit slower, you know, especially when it comes to digitalization of hospitals and also the practitioners, you know, because in Germany that is all yeah, that was a very painful and slow process, whereas in other countries where it's just part of the industry, basically, you know, people just choose more freely because they don't have the same type of insurance regulations that we do have, yeah. And not only regulations, but I mean, in Germany, it's a very good thing, you know, that everyone has to be part of a medical insurance, has to have a medical insurance, you know. Whereas in other countries, you can kind of opt, you know. It's not that much governed by principles of the industry, but it's a very safeguarded and regulated area. And that, of course, makes it very difficult to kind of quickly introduce new things, you know. And during the pandemic, we have almost painfully realized that the medical sector is not digital at all in Germany. And at the same time, using digital medicine and also data sets from patients just allows us so much better to focus on personalized medicine and also precision medicine. So I think, you know, it's been a painful 2 years, and I'm quite happy that the government has realized that and has also try to promote that sector by giving us millions of euros, or that you can apply for that, you know, to further digitalize the hospitals.
So when looking at young people, I mean, you have a sort of a mixed academic background, medicine and management. So would you say that, would you encourage young people who have not a medical background also to look more, you know, into the medical part of the business and the economy to help you to advance digital topics like AI?
Yes, definitely. I mean, as we've all painfully realized, you know, medicine and healthcare system is very important to us. And I think in Germany, people have come to realize that we've got a very good healthcare system. Whereas in previous years, you know, it's always been the talk, you know, that people said, oh, we've got far too many hospital beds in Germany, you know, and in other countries, you are either not admitted at all for certain diseases, or you are admitted, briefly operated, and then we call it a bloody discharge, you know. So as in you are being discharged while you're still in Germany, you would still be in the wards, you know, and be an inpatient. And in many other countries, that is a long time ago. And in Germany, I'm sure, you know, that people nowadays, they realize that healthcare is very important, and we've got a very good healthcare system. We've got excellent scientists, we've got excellent doctors, and that whole area, medicine, is very important. But if it comes to digitalization and also big data research, we are still, yeah, in our beginnings, you know, and yeah, the government has given us grants also like 5 years ago that started with the Medical Informatics Initiative. And I think for young people, it's a very rewarding field because there are still so many things that you can do here, you know, so many maybe if you're I don't want to say simple technologies, but I mean, if I look at my own daughters, you know, that have grown up with digital technologies, of course, you know, you've got a different approach to it, and you probably think in shorter ways than my age. I'm in the beginning of my 50s, you know, that I think, because I kind of think of the old manual processes and then transform them. And I'm fully aware, you know, that I need to talk to other people, you know, to avoid doing that, and don't go on a detour road, but go straight, you know, and discuss it. So I think that can be very rewarding. And at the same time, healthcare is very important to us, and people have realized that without a good healthcare system, you know, we wouldn't be what we are in Germany.
Yeah, I agree. And you mentioned your daughters, and also their possibly slightly different approach to digital aspects of our life. Let's talk about another aspect. It's social media. What is the role of social media in what you are currently doing?
Well, we in Essen have realized that many information topics, you know, are being exchanged via social media, and that is very important when it comes to how people look at you, you know. So traditionally, I mean, medicine and that whole medical community has been kind of secluded, you know, and was only if, in the focus if you were actually sick, you know, or if you were admitted to a hospital. But nowadays, I mean, also with digitalization, it's very important, you know, to include the patients in what you do. Like personalized medicine also includes the symptoms that a patient has got. You know, it includes to integrate patient-reported outcomes, what we call it. So it's like questionnaires that you send to the patient, and that is part of the whole data system, you know, that you look at while you're treating the patient. So it's not so much like it used to be, you know, in hierarchy where you just said, well, you take that medication and full stop, you know, but you very much include the patient, and the patient is kind of part of that digital universe of medicine. And the only way to do that is if you use not only social media, but also digital data sets, you know, because otherwise you can't include the patient. So it does allow us, you know, to talk about what we do to well, raise awareness, very much so, you know, and also get people to understand why we do certain things. So it has become an integral part of our lives, basically.
So you clearly state that, I mean, younger people and also younger technologies like social media, let's say, clearly influence also your medical world. So let me ask you a question, because you also mentioned that the medical world is a very hierarchical world in a hospital. And I would not like to challenge that. But with younger people coming into the hospital environment, do you see an influence also that younger people are certainly challenging this hierarchical view in the hospital, and also probably integrating more modern leadership styles? Do you see a change there?
Yes, definitely. We do see that change, especially in that whole aspect of digitization and cultural transformation that goes with it, whereas even, well, the whole society in Germany changes, with integration of migrants, with other religions, with seeing the differences in gender, etc., all on one level. I do get the feeling that, well, not only at medical school, but also for the other professions that are partly academic now, like, I mean, nursing, you can go and do a traditional nursing education or physiotherapy education, etc. But you can also go to a university in order to learn that, so there's much more mixing, and that is something that I definitely am very fond of. And when it comes to my own career, as you mentioned it, I've went to medical school also at the University of Cape Town. I went to school in Eswatini, and there I really experienced that the way people were educated, but was so much more liberal and demanding as well. In Germany, I very often get the feeling that even now, if, people don't want to ask a question because asking questions, for instance, traditionally is seen as, oh, she doesn't know that, you know. Oh, she must ask that question, whereas elsewhere, you are encouraged the whole time, to ask questions.
To be
And
curious.
yes, be curious, and teaching is something that just happens all the time. Like I remember teaching in emergency room, somebody comes in with a seizure, and the registrar, which is like someone that is already uh, that holds like a degree, in one of the medical specialties, would then immediately ask the students that are present, okay, so what do you do? What do you see? What do you do? What medication do you think of? What do you have to exclude? Whereas here, it would all be just focus on emergency room, and no student is allowed to ask a question, sort of thing, and that was something that definitely left its marks, in my character and my approach also to the students and the young people.
So you clearly, let's say, encourage people, even if they have a university degree, to really continue with lifelong learning. Otherwise, a career, and not only a medical career, nowadays would not be possible anymore, right?
Exactly. I mean, look at me. I still have to go for another 15 years, or probably, if you look at our retirement system, probably I have to work for another 20 years. But if I were to have stopped 20 years ago, I wouldn't be doing what I'm doing now, So in our profession, it's actually been something that has been regulated also by the government, that you have to keep on, you have to carry on getting, well, points for educating yourself, you know, and looking into new advances in medicine. But that whole field of digital medicine and now AI, of course, is something that we didn't dream of. I mean, if like I worked first in neurology and then in neuroradiology and radiology. And in radiology department in 1999, we only introduced the digital picture archiving systems. Up till then, we had printouts on X-ray, you know, that you looked at in front of light cases. So that is something like historic, you know, people would now say, wow, you printed it out on films, you know, whereas everyone is now used to digital pictures that you can actually also send via the internet somewhere else, get a second opinion. And even more so with the pandemic, I mean, so many digital processes have been introduced in our daily lives, and it proves that they're good for us, you know, that you don't have to carry around your vaccination booklet, but you've got your smartphone with you. And even my mother at the age of 81, of course, she knows how to handle a COVID Pass app, you know, or the Corona app or other apps, you know, and is also able to write a WhatsApp, for instance, you know, or some text messages. So it's part of our lifelong learning, and many things have been facilitated using that.
Anke, it's really fascinating listening to you. So, as a closing question, if I may, could you share with the audience, is there any, you know, major achievement or major objective you have for this year with regards to, you know, transformation, AI, digital, anything you would like to share?
Well, actually, for 2022, at the end of last year, I've been newly appointed into the Interoperability Council of the Ministry of Health. So that is something for medicine which is really important, you know, that we get away from these data silos where all the specific data sets are being stored and they're not able to interact, interoperable. And that is something very important for all of us, for the whole of Germany, for our population, you know, that we have our own electronic health record, the elektronische Patientenakte, that all the people that have got a medical insurance, you know, can have access to. And I do hope that they change that into the so-called opt-out system, you know, that you are being obliged by law to have that health record and use it. And only you can apply then to opt out. But at the moment, it's an opt-in, and not even 1% of the German population has got that health record. And while we all as patients must learn that we're also responsible for our health data sets, for our health, you know, and nobody will do it for us. We must dig into that, you know, and be also the masters, you know, of our own data.
So that reminds me to do myself some of those things. Thank you, Anke.
Yes, you better do so.
Yes, it was a real pleasure talking with you today. I wish especially that later this year you will be able to visit South Africa again.
Yes, thank you very much, Paco. Have a good day.
You too. Bye-bye.
Bye.